Please stand by. We're about to begin. Good day and welcome to the Health Insurance, Healthcare, and Behavior Among Children of Immigrants webinar. Today's webinar is being recorded. At this time, I would like to turn the webinar over to Kristen Moore. Please go ahead.
Thank you, and welcome everyone to this webinar by Julia Gelatt with Don Winstead as discussant. I'm Kristen Moore, Senior Scholar at Child Trends, and I'm the moderator for this Emerging Scholars webinar on health insurance, healthcare, and behavior among children of immigrants. The Self-Sufficiency Research Clearinghouse, by way of background, is a virtual portal of research and other resources related to self-sufficiency. It functions as an online community for researchers, practitioners, and other stakeholders interested in self-sufficiency, employment, and family and child well-being. So I hope you've all been on and used the SSRC. The purpose of the SSRC is to disseminate quality research, and we currently have over 4,000 items in the library, and we're constantly adding new resources. The library's materials are organized into the 12 topical areas that are shown on the right side of this screen. Every item included in the library is reviewed for relevancy, and users can search by keyword or use filters like topic area, target population, geographic location, or research methods to browse the collection. Every topic area under the Browse Topics tab includes our librarian recommends. This box highlights research and resources recommended by the SSRC library team. Each topical area also includes relevant federal laws and regulations. Under the Stay Connected tab at the top of the screen here, you'll find entities involved in self-sufficiency research and a list of organizations that have partnered with the SSRC to host events and share publications related to the field of self-sufficiency. You'll also find an events calendar that includes in-person and virtual events relevant to the field of self-sufficiency. Please visit this tab in order to access previous webinar recordings and additional materials. And finally, the SSRC houses a number of data sets and sources to support program management and facilitate improved outcomes for children, families, and communities. On the right side of your screen, you'll find links to the library and Emerging Scholars information page and a link to subscribe to our monthly newsletter. Just select a title and then click Browse To in order to open the next window. Well, please feel free to nominate someone for a future Emerging Scholars slot. Just email the address shown on this slide. The criteria are shown on the right side of this slide. We're looking for a graduate student or a degree recipient, but with no more than 10 years of experience, who's currently doing research on self-sufficiency issues related to the 12 topic areas shown on the previous slide and also on the website. Someone who's conducting high-quality research that fills the knowledge gap. And this person can be working in an academic program, think tank, or agency setting. There's no restriction. It's really if they're doing interesting research that fills a gap. We just wanted to show you a few of the topics that have been covered by previous emerging scholars to give you a feeling for it. You can see family structure, statewide job losses, early care and education, both accumulating assets and also asset depletion, paternal incarceration, job loss, and using administrative data for workforce development programs. Quite an array of topics. And today, we're going to hear from Julia Gelatt, who's a research associate at the Urban Institute. She has a PhD from Princeton University in sociology and social policy, which she received in 2013. Her research interests include vulnerable youth, international migration, demography, ethnicity and gender, and healthcare access. So you can see that her talk today integrates several of these interests. Our discussant is Don Winstead. He served as Deputy Secretary in the Florida Department of Children and Families and Special Advisor in the Office of the Governor in Florida. He also served as Deputy Assistant Secretary for Human Services Policy in the Office of the Assistant Secretary for Planning and Evaluation in the U.S. Department of Health and Human Services. After Julia's presentation and brief discussant remarks from Don Winstead, we'll have time for Q&A. Please submit questions anytime through the question and answer feature, which is at the bottom right of your screen. As I mentioned, questions will be answered after the presentations, or if we run out of time, responses will be posted on the SSRC with the other webinar materials after the event. Thank you. I'm turning now to Julia.
Thank you so much, Chris, for the introduction, and thanks to SSRC for the opportunity, and Don for your comments, which I look forward to, and thank you all for joining. I just want to say before I start, this is some work that I completed before I joined the Urban Institute, so this is my work and my opinions. I'm going to start just by framing the issue of children of immigrants in the United States and children of undocumented immigrants in particular. So as many of you probably know, children of immigrants are a growing share of all kids in the United States. In 1990, about 13% of kids had at least one foreign-born or immigrant parent, but today that share is about 1/4 of all kids who have an immigrant parent. And we hear a lot in the news about the 11 million undocumented immigrants in the country. Until very recently, in Obama's recent executive action, there has been much less discussion about the children of these undocumented immigrants. But you can see they've been growing in numbers. So back in the mid-90s, there were over 2 million kids in the U.S. with at least one undocumented immigrant parent. Today, that number is over 5 million. But as you can see as well by the light blue shading in this graph, the majority of kids with undocumented parents, 85%, are themselves U.S.-born U.S. citizens, and then there are less than 1 million children, 0 to 17, who are themselves undocumented immigrants. So why should we think about or worry about children of undocumented immigrants? How might lacking legal status in the United States affect parents and kids? There's a growing amount of research on the topic. So we know that undocumented parents, because they lack permission to live and work in the country, tend to have precarious work lives, working in jobs with lower pay and poor working conditions on average, less flexibility, fewer benefits. Undocumented immigrants are not eligible for most federally funded public benefits in the country, and for that reason, undocumented parents may be less likely as well to apply for benefits for their kids, even when their kids are U.S. citizens and even when the family is income eligible. Undocumented immigrants in most states can't get a driver's license, which limits mobility, which affects work lives and ability to participate in kids' activities and all sorts of forms of mobility. And one way that lacking a driver's license can create problems is if parents inevitably end up driving without a license, which can put them at risk for detection and deportation. So fear of deportation is pervasive in immigrant communities where there are a lot of undocumented families or mixed status families, that is families where kids are U.S. born but parents are undocumented, and that can have mental health implications. Fear of deportation is not an unfounded fear. The government reports that they deported about 72,000 parents of U.S. citizens last year, and that number was a little bit higher in recent years. There's also some emerging research looking at how parents' immigration status affects children. So Hiro Yoshikawa's work in New York City showed that young kids with undocumented immigrant parents had lower early learning skills or cognitive skills at age 3 compared to kids with legal immigrant or native parents. Some work by Frank Bean and others in Los Angeles showed that adolescents who had grown up with undocumented parents had fewer years of educational attainment than those who had grown up with legal immigrant parents. And Joanna Dreby's interviews with immigrant kids and families in Ohio and New Jersey showed really high rates of fear of parents' deportation among children of undocumented immigrants. There's also been some emerging research looking at undocumented youth, or what are often called dreamers, because they would be eligible for the long pending DREAM Act, and showing the really difficult transition to adulthood as youth look forward to blocked educational opportunities given lack of access to in-state tuition or financial aid support, given blocked future work opportunities, given their lack of work authorization, and kind of all of the mental health implications and worries that that brings. But there's been less attention to how immigration status affects the mental health of younger children, and there's been less focus other than descriptive numbers of how immigration status affects access to health care. In this presentation, I'm going to talk about 3 different papers. The first 2 look at how immigration status is associated with children's health insurance coverage and healthcare use. And then the third looks at how immigration status is associated with children's behavioral problems, which are a common measure of mental health. I'll explore some pathways between immigration status and child well-being and end with some policy considerations. In the first two papers, I ask, how does having undocumented parents affect children's access to health insurance and health care? And how does a child's own immigration status affect their access to health insurance and health care? Why would we expect parents' immigration status to affect access to insurance and health care? I talked a little bit about how undocumented immigrant parents might be less likely to sign their kids up even when they're eligible for public health insurance, such as Medicaid or CHIP, in addition to confusion about the fact that parents aren't eligible, but kids may be. Undocumented parents might be afraid of that application process or may have trouble providing the necessary documentation to prove their income eligibility and residence in the area and that type of thing. We also know that undocumented parents, because of the jobs they tend to work in, are less likely to be offered public, health insurance at work, and there's some evidence that they may be less likely to take up health insurance even when it's offered at work. And we also think that undocumented parents may be less likely to take their kids to the doctor when they need health care or for regular checkups because of fear of accessing health care in institutions that are sometimes seen as part of the government, because again of the lack of driver's license and transportation issues or long work days or flexible work schedules that make it difficult to get to the doctor during the hours when they're open. And why would kids' own immigration status affect their access to insurance and care? As I mentioned before, undocumented immigrants are not eligible for federally funded public benefits like Medicaid and CHIP. There are a few states that choose to use state funding to provide health insurance for children regardless of immigration status, but they're pretty limited in number. And there are a few counties as well in California and Florida that make that same choice. So in the first paper, I'm going to use a data set from Los Angeles. This is called the Los Angeles Family and Neighborhood Survey, or LAFANS for short. It's representative of families in Los Angeles County. It was conducted in English and Spanish. For that reason, I focused just on Latino families. And what's really great about LAFANS is that in addition to asking about place of birth and citizenship, like many U.S. surveys do, they also ask about precise legal status. So they ask non-citizens if they have a green card for lawful permanent residence. And if someone says, no, they don't have a green card, then they ask if they have a legal visa, a legal temporary visa, and if that visa is still valid. So using those questions, you can estimate pretty well who is undocumented in the survey. And I should mention that these data come from the early 2000s, so we should all imagine that we're back in the Bush years. This is before Obama's executive action for youth or for parents. This is before a lot of the contemporary discussions around immigration. So I use this information on legal status in the LAFANS survey to categorize children into 4 family types. Native families have U.S.-born parents and U.S.-born kids. Legal immigrant families have legal immigrant parents and legal immigrant or U.S.-born kids. Mixed status families, again, are families with undocumented immigrant parents and U.S.-born kids. And undocumented families have undocumented immigrant parents and undocumented children. And moving forward, I'm going to rely on some comparisons between children in undocumented families and children in mixed status families to see associations between children's own immigration status and their well-being. And I'll rely on some comparisons between children in mixed status families and legal immigrant or native families to see how parents' immigration status is associated with child well-being. As I mentioned before, I focus just on Latin American families with origins in Mexico or Central America. And I have a little over 1,000 cases. I look at 4 outcomes. The first is whether the child has health insurance and whether it's public or private, whether the child has the usual source of health care. This is something that's been shown to be associated with getting sort of needed health care in the case of illness or injury. It's also been shown to be associated with getting regular checkups as recommended by pediatricians. I look at whether the child had a well-care doctor visit in the past year that's seeing the doctor for something other than illness or injury for a routine health checkup, and then whether the child saw a dentist last year. So first I'm just going to show a descriptive picture. Here I'm not controlling for anything. These are the types of health insurance held by kids in Native families, legal immigrant, mixed status, and undocumented families. You can see in the Native families, the majority of kids have private health insurance coverage. In legal immigrant families, there's quite a mix. In the mixed status families, a pretty big share have public health insurance coverage, and in the undocumented immigrant families, over 70% have no health insurance coverage. If I control for family income and mom's age and household structure, parents' years in the U.S., and all these things, the difference in the share lacking health insurance is significantly different across immigration status categories. But I should just note here that because I'm not controlling for household income in this picture I'm showing you, part of the reason you're seeing a big share of public health insurance coverage among the mixed status families compared to the legal immigrant or Native families is that more of those families are low income and are actually income eligible for the public insurance. So next, looking at the usual source of health care by immigration status, you can see again there's some difference. Across all the groups, most kids are going to a clinic as their usual source of health care, but the kids in the undocumented immigrant families, over 30%, have no usual source of health care. Again, this is just a descriptive picture, but the difference in the share with the usual source of health care is significant when I control for family income, family structure, age, gender, years in the United States, and that type of thing, other measures of family socioeconomic status. Okay, next I'm just showing the share of kids that had a checkup last year by immigration status. Again, this is just the descriptive share. You see it's a little surprising that there's not much of a difference. Undocumented kids, kids in mixed status families, legal immigrant families, and Native families have relatively similar rates of seeing a doctor. And once I add in all my controls, I actually see the same thing. There's really no significant difference in the probability of having seen a doctor last year. Then looking at the share that saw the dentist last year by immigration status, here's the descriptive picture. It looks like there's a little bit of a gradient. So kids in Native families are the most likely to have seen the dentist last year. It's a little bit lower in mixed status families and in undocumented immigrant families. When I add in all of my controls, kids in undocumented immigrant families are significantly less likely to have seen the doctor last year compared to kids in Native families or kids in mixed status families. So it really seems like children's own immigration status is associated with lower rates of seeing the dentist. So one thing that's a little bit tricky in looking at access to health insurance and health care is that there are two different factors going on. One is whether kids are eligible for insurance and whether their immigration status makes them eligible. And the other thing is what parents are choosing for their kids. So do undocumented children lack health insurance because their immigration status makes them not eligible for public insurance? Or do they lack it because their parents just don't sign them up for insurance? Do undocumented kids not have usual health care provider because they don't have health insurance or because their parents don't seek out and find them a usual care provider? So in my next study I'm going to show you, I compare siblings in the same family who have different immigration status. And I do that to net out the role of parental choice and just focus on the role of children's immigration status. In this study I used the National Health Interview Survey and the Medical Expenditure Panel Survey. The NHIS is an annual survey of, nationally representative survey of U.S. families, and the MEST is a survey of a subsample of NHIS respondents. As I mentioned, like most other surveys, they ask about place of birth and citizenship status, but they don't ask about precise visa status, so I have to guess a little bit about who's undocumented. So as I mentioned, I use sibling comparisons. So I select a sample of children who are living with foreign-born, non-citizen parents, and I focus just on families from Latin America. And although I say Latin America, actually 93% of the families are from Mexico, and the other 7% are from Central or South America. And I select kids who are in what I call a mixed citizenship cibship. So this means there's at least one child in the family who is a U.S.-born U.S. citizen, and there's at least one child in the family who is likely undocumented. And when I say likely undocumented, what I mean is a non-citizen child born in Latin America who entered the U.S. before age 15. Of course, we know not all non-citizen foreign-born kids from Latin America are undocumented, but about 70% of Mexican non-citizens are estimated to be undocumented, so it's a relatively good proxy, and to the extent that I have measurement error, that's going to sort of attenuate my results. They're going to be conservative results. And you might be thinking that this is kind of a weird family where there's one child who's a U.S.-born citizen and one child who's undocumented. It's actually estimated that 40% of the undocumented kids in the U.S. today live with at least one U.S. citizen sibling. So I look again at 4 outcomes that are pretty similar, whether the child has no health insurance, public health insurance, or private insurance, whether the child has a usual health care provider, whether he or she saw a doctor last year for a healthy checkup, and whether they saw the dentist last year. So here again is a descriptive picture of insurance coverage. So remember, the citizen kids are citizen kids with an undocumented sibling, and the undocumented kids have a citizen sibling. So among the citizen kids, about 80% have public health insurance coverage, and half of the undocumented kids have no health insurance coverage. About 40% have public insurance coverage. And again, that difference is significant regardless of what I control for. Here I'm showing you the adjusted probabilities in having a usual care provider, getting a checkup last year, or seeing the dentist last year. I've run these models different ways. In some I use what's called fixed effects to compare siblings directly to each other. So I only look at siblings in the same family. In other cases, I use models where I control for things like age and family structure, region of the U.S., parents' education, poverty status, parents' years of U.S. residence, and the language of the interview. I tend to find the same findings whatever I do, which is that undocumented kids are significantly less likely than their U.S. citizen siblings to have a usual care provider. But the difference in rates of getting a healthy checkup or seeing the dentist, those differences aren't significant. I looked at some models for just kids under age 9. So if you just look at younger kids who are more likely to be taken to the doctor regularly and to the dentist regularly, there's some mixed evidence that there might be lower rates of seeing the doctor or dentist among undocumented kids compared to U.S. citizen siblings. But those results are mixed. So I looked at similar pictures in Los Angeles and then in this national level data. In both cases, I had some comparisons between undocumented kids with undocumented parents and kids who are U.S. citizens but have likely undocumented or undocumented parents. In Los Angeles, I found that compared to the U.S. citizen kids with undocumented parents, undocumented kids had lower health insurance coverage, and I found a similar story at the national level. In LA, I found that undocumented kids had lower rates of having a usual care provider compared to kids in mixed status families. I found a similar thing in the national data. In LA, I found that undocumented kids and kids in mixed status families had similar rates of getting a healthy checkup, and I saw that in the national level data. And then my findings on seeing a dentist were a bit mixed. In LA, I saw lower rates of seeing a dentist. I didn't see that at the national level. So next, I'm going to turn to a slightly different topic to look at how the mental health of children of immigrants compares to that of children of U.S.-born parents, and how parents' immigration status and children's immigration status is associated with children's behavioral problems as a measure of mental health. And then I look at some of the pathways between immigration status and children's mental health. So why would we think that immigration status might matter for kids' behavioral problems and mental health? I've mentioned already this fear of deportation, so parents are maybe afraid of their own deportation, which creates anxiety and can create depression as well. Kids tend to pick that up. Kids also may be aware of their parents' immigration status or their own immigration status and be afraid of losing a parent to deportation or being sent to a country that they hardly remember. Joanna Dreeby's work, interviews with immigrant families, found a lot of stigma and shame around immigration status, and interviews with undocumented youth show the same thing. There's, different periods of time, a lot of negative press about undocumented immigrants, and people tend to feel really ashamed of all the limits that are present in their lives because of their immigration status. Again, there's blocked future opportunities for kids who are themselves undocumented, and we know that mixed status and undocumented families have higher rates of poverty and material hardship, which can affect mental health. So use the same Los Angeles data as before, just a refresher. And I categorized kids into these 4 family types in the same way as before. My sample size is just a little bit smaller here because there's more missing data on the parents' reports of children's behavioral problems than there was in the health measures. So in looking at behavioral problems, I look at 3 different scales. And these scales are created by asking parents a list of, they name a list of 28 behavioral problems and ask whether each was often true for the child, sometimes true, or never true. And then create an overall scale of these 28 items, an internalizing scale, which focuses on things like anxiety and depression and clinginess and being withdrawn among kids, and an externalizing scale, which measures misbehaving and acting out or displaying anger or yelling. In this graph, I'm showing the percentage difference in behavioral problems for kids in the 3 types of immigrant families compared to children in native families. You can think of the children in native families being right at that 0%. So if you look first at the overall behavioral problem scale, you can see that kids in all types of immigrant families have significantly higher behavioral problems than kids in native families. And this is more true for kids in mixed status families and especially true for kids in undocumented immigrant families. Looking at the internalizing behavioral problems, again, this is if kids are anxious or withdrawn or clingy. Again, you see the same story. So kids in all types of immigrant families have more reported behavioral problems, and it's particularly true in mixed status and particularly in undocumented immigrant families. For the externalizing behavioral problems, things like acting out or yelling or misbehaving or showing anger, here only the kids in the undocumented immigrant families have significantly higher externalizing behavioral problems. And they're significantly higher both than kids in native families and significantly higher than kids in mixed status families. So again, it really seems like children's own immigration status is what's associated with the greater externalizing behavioral problems. So I thought that I was going to find that that maternal depression was higher in mixed status and undocumented immigrant families, that moms in those families might have lower self-efficacy or feelings of control over her life, that immigrant parents might show more parenting stress or aggravation with parenting, and that would explain away this these behavioral problems among kids in immigrant and mixed status and undocumented families. But actually what I found was that maternal depression is highest in the legal immigrant families, and maternal self-efficacy is lowest in mixed status families, and that really none of these measures of mother's mental health explains away the poor mental health in immigrant and especially undocumented immigrant families. So just to summarize the findings, I showed that children in undocumented families are more likely to be uninsured than children in native or mixed status families. They're less likely to have a usual care provider, but they're about as likely to see the doctor for a checkup, and the findings were a bit mixed on rates of seeing the dentist. Children in immigrant families show greater overall and internalizing behavioral problems than kids with U.S.-born parents and native families, whereas kids in undocumented families, kids who are undocumented, show greater externalizing behavioral problems than kids with U.S.-born parents or kids in mixed status families. This leaves a number of unanswered questions. I think the most pressing is I showed that kids in undocumented immigrant families are less likely to have health insurance, they're less likely to have a usual care provider, but they're about as likely to go to the doctor for a checkup. So where are these families going? Where do undocumented and mixed status families access their health care when they're uninsured, when they don't have a usual source of health care? Also, there's been a lot of, since the mid-2000s, a lot of effort in different states to enforce immigration law, Arizona being sort of the most classic example of this. And so how are these state immigration enforcement policies interacting with state health insurance policies to shape immigrant families' access to health insurance and the rates at which they take up available care? And then what resources could support family mental health in mixed status families? finally, to end with some policy considerations, first, I think it's important to consider what are the implications for families and for communities when immigrants lack health insurance. So it's important to tally up the costs, both in terms of monetary costs, but in terms of well-being as well, medical spending and health in families. Second, I think localities can consider how to encourage and facilitate uptake of public insurance when it's available for eligible children. So we know there are some application processes that that can deter uptake and other barriers that immigrant families face in trying to access health insurance even when they're eligible. I mentioned that some states have chosen to use local funding to provide public insurance for children regardless of immigration status, and that's a question that states and local areas can consider, is whether to provide public insurance for other segments of the unauthorized immigrant population. More broadly, policymakers can think about how immigration enforcement policies affect the well-being of U.S. children, and then of course, sort of hanging above all of this is broader immigration reform and future efforts to reduce the size of the undocumented immigrant population, which is raising all of these policy questions. I'd just like to thank my funders, the National Science Foundation and the NIH, and thank you all for listening.
Thank you, Julia. Next, we're going to hear from Don Winstead, our discussant, but please share your questions in the Q&A box on your screen at any time. Don?
Great. Thank you very much, Chris, and thank you, Julia, for a very timely and very interesting presentation of information. It seems to me that the information that you're presenting lies at the intersection of several kind of important policy considerations. Obviously, today, both immigration reform and healthcare policy are very much live issues, and your presentation really, certainly provokes questions that are relevant for both of those. It also seems to me that that the presentation also kind of lies at the intersection of traditional notions of public health versus personal health, and there has long been a consideration that the overall public health issues are ones that should apply universally, where personal health and health insurance coverage less so, which certainly begs the question of kind of what is the stake that that all of us might have in the healthcare status of people, whether or not they're eligible for public benefits. And I think there are a lot of issues suggested in there in the presentation. A couple of points and then maybe a couple of questions to start off for Julia. It seems that certainly in the LA data, particularly being able to control for socioeconomic status and other things, you see some of the differences there. One of the questions that I think was also interesting in the data is by comparing the LA data with the NHIS and MEPS information, at least suggested some generalizability of the LA data. And I guess one of the questions I wonder if Julia might comment on in just a second is the extent, having looked in detail at this data, as the LA findings, particularly in the behavioral health area, whether you think that also holds up in terms of potential generalizability. And I guess the other real question now is, given what's happened since this data was collected in the early 2000s, and particularly some of the recent policy initiatives with the Obama executive order that's just been in the news and other, how that might change or affect these issues going forward. The other question I have is to whether or not you were able to look at in the data. One of the things, and particularly given the findings with the behavioral health and the differences, the significance of the differences in the undocumented segment of the population that you looked at, both in internalizing and externalizing behavioral issues, is one of the kind of things that we've seen as a trend in recent years is really significant growth in take-up for SSI and also SSI among children. And given the evidence of behavioral difficulties among these children and the fact that they're not eligible for SSI, what the implications of that might be in not only in terms of health care, but in terms of then future issues in terms of those children. And then the other question that I wondered, just given receiving cash assistance, whether it's locally funded, state funded, nationally funded, or whatever, has long been a consideration in public charge as to whether or not people who are here legally can be considered for citizenship, or whether or not they can convert to lawful permanent status, is now, with some of the changes in immigration policy, whether or not this would be a perceived issue that individuals might consider in terms of their willingness to accept assistance, even for children that may be U.S. citizens, and whether that might be part of the barrier issue. I guess the final comment, that frankly I thought, given the differences in the healthcare coverage, that the lack of difference in the access to health care was a somewhat surprising finding, and wondered if you, Julia, if you had any more insight as to this difference between having coverage and obtaining access, and what that might say overall about policy considerations. So those are at least some things that occurred to me in looking at this very interesting presentation, but particularly wondering about the policy implications of it.
Great.
Great. Thank you.
That gives me a lot. Should I?
Go ahead.
Oh, yeah. Should I go through those, or do we want to see if there are other questions? Or
Don has raised some wonderful questions. Why don't you start out addressing some of them, and then I've got a few accumulating here as well.
Okay, great. Thank you, Don, for those comments. That definitely brings up a lot of great policy issues. I'll try to address them in order, and if I forget anything, just let me know. First, in terms of Los Angeles and whether that holds up in terms of generalizability, that's a really good point. Los Angeles is a very particular context. It's a city that's absorbed a lot of undocumented immigrants for more years than most U.S. cities have been doing that. And because of that, there's a rich social service environment that's well prepared to deal with immigrant families and to serve their particular needs, and knows sometimes how to navigate the particular issues related to mixed status families and undocumented immigrant families. So to some extent, I think that any disadvantage that's observed in Los Angeles would be a very conservative estimate of what you might observe elsewhere. Of course, I did find pretty similar things in many cases in NHIS data, so that suggests that it's a reasonable case study to take and to take some implications of that. You mentioned that the data come from the 2000s and that things are really shifting, so that's a really important point. I want to talk about the Obama executive action a little bit. So Obama announced recently, we all know, that parents of legal immigrants and U.S. citizens can apply for something that's called deferred action. So this isn't legal status. It's not a path to citizenship, but it protects parents from deportation and gives them access to work authorization. And so we don't even know yet how many parents will sign up. The application process has a over $400 fee, and parents have to prove their continuous residence in the U.S. for the past 5 years, which people who have been purposely not leaving a paper trail, that could be kind of difficult for parents. But if parents are able to sign up, I think that could help them get access to insurance and care for their U.S. citizen kids in particular. So parents who apply for this program and who are given this deferred action, they're not eligible for any federally funded public benefits. They can't participate in the Obamacare exchanges in their state. But they may be more willing to sign up for public insurance for their U.S. citizen kids. They've already told the government they're here. They've already put together all this paperwork for the government. They've already come out of the shadows, so to speak. So taking that extra step to apply for insurance for their kids might all of a sudden seem less scary. And, you know, the Obama administration and HHS and everyone's tried to make it really clear that undocumented parents shouldn't be afraid of buying insurance for their kids through the state exchanges. You know, the immigration enforcement agents say they're not going to use the exchanges to try to find undocumented immigrants. They're not going to deport parents because they've signed up for health insurance for their kids. So hopefully those who have this deferred action will feel more comfortable doing that. After Obama's last executive action, which was for youth who would qualify, more or less would qualify for the DREAM Act that hasn't yet passed, after that happened, some states chose to use state and local funding to provide public health insurance for youth who had that deferred action through that program. So it remains to be seen if any states will kind of take a similar approach to the parents who are getting this new status. In terms of you mentioned the behavioral health and that there's been kind of a national trend overall in the growth of take-up of SSI, but that undocumented kids wouldn't be eligible. Yeah, that's an interesting point. SSI isn't something that I'm particularly familiar with, but I just want to say that I'm not sure how much behavioral problems are really an indicator of disability necessarily. The behavioral problems many of them are pretty mild things, and, you know, kids tend to throw temper tantrums now and then and tend to be shy and withdrawn in certain situations, and so I think I would see it more as an indicator of lower level mental health problems. In some cases, these could be kids who have real behavioral problems, but I'm not sure the extent to which that these findings should be taken as showing higher rates of disability necessarily. You mentioned the cash assistance and the issue of being a public charge. So if legal immigrants who have the right to apply for citizenship use certain public benefits like cash benefits, it's true that can hurt their ability to get citizenship in the future. I'm pretty sure, and if someone knows better, they should correct me, but I think that access to Medicaid is not part of that. So I think it's okay.
That's correct, yeah.
Right, okay, so I think it's okay for parents to access public insurance for their kids, and then given the way, you know, how that ties in with the executive action, given that there's really no new eligibility for federal benefits, I'm not sure what's going to happen there. I do know that the last time that the Senate passed a comprehensive immigration reform bill that would put some people on a very long path to citizenship, they were talking about keeping families from accessing public benefits, federal public benefits, for a long time. So I think there may be there's definitely a lot of thinking going on about what different immigration reform policies would mean for rates of benefit use. But I think that all remains to be seen. I think next time we have a bill, it could look very different. So we'll have to see about that. And finally, you talked about, the very surprising finding that even given pretty big gaps in health insurance coverage and having usual care providers, there aren't such big gaps in terms of seeing a doctor, and I was really surprised about that. I mean, I think there's not as much information available as we would hope about where uninsured immigrant families are getting their health care. So there are, of course, community health centers and federally qualified health centers that take people and provide basic health care regardless of immigration status. So that's a big part of the system. I've also seen some sort of scattered small-scale qualitative studies and some news reports about other strategies. So some families rely on, alternative medicine and kind of faith healer type things. Some some families are able to find doctors who were certified as doctors abroad, but may not have obtained their U.S. certification, who can provide health care at a lower cost, kind of outside of the regular system. There's some kind of storefront clinics that have opened up in immigrant neighborhoods in Los Angeles, and then this isn't really what I was showing today, but legal immigrants oftentimes, if they live close to the border, will actually go back to Mexico to get cheaper health care in Mexico. So I think we need more research on the topic of where immigrant families go when they don't have health insurance coverage and don't have a usual care provider, but are still seem to be getting health care when they need it.
Yeah, it would be interesting to know also in that if there are any differences in terms of whether they access their health care, not for well care, but when children are sick, whether the access is through emergency rooms, which is something you hear, at least anecdotally, a lot of perception that is the case.
Yeah, I did. There was a question in the LA Fans that asked about emergency room use, and the reported rates were so low. I think it's hard to know. I mean, kids tend to be healthy, so that's a good thing if they're not going to the emergency room, but it was hard to see any variation there. And that's the tricky part about trying to study disparities in rates of going to the doctor for illness and injury is some kids get sick more often and then can or can't see the doctor, and other kids get sick less often. So you're kind of mixed up about whether the kids are healthy or unhealthy and whether they have a source of health care when they need it and when they don't. It's a little bit trickier to study, but I think, yeah, that would be very interesting to look at, too.
Yeah, lots of future research to be done, it's clear. So one question that we have is that it's interesting that differences seem stronger for behavior than health care. Why might effects be stronger for behavior?
Yeah, it's hard to compare things that are so different and on different scales and that type of thing. I'm not sure if sort of in the importance, if they're bigger, they looked bigger because of the way I presented the percentage differences. I'm not sure if they're absolutely sort of bigger differences, but we were seeing significant differences for all children of immigrants compared to children of natives in the behavior, and we didn't see that always with the healthcare access. So I think one thing could be that mental health is, it's not a yes or no thing, right? It's not that you're mentally healthy or not mentally healthy, but there's different levels. So it's easier to pick up maybe small changes if kids are experiencing all these different influences in terms of the, maybe poverty and material hardship in their families, or stereotypes about immigrants that are being, passed around in the news or even at school. These fears of deportation or just sort of the stress of living as an undocumented parent, kids are picking up on that. So it might be that the measure is a little bit more sensitive to kids' experiences versus having a doctor or not having a doctor. It's kind of a more structured thing.
Mm-hmm. A follow-up, are there differences in the physical health of the children?
Yeah, so I did look at that as well. What I generally found was that that in terms of, so the way that the LA Fans data and many data sets look at children's health is parents' reports of children's global health, which is kind of a subjective measure, and then whether kids have certain health conditions. So has a doctor ever told you your child has asthma? Has a doctor ever told you your child had 3 or more ear infections in a year, that type of thing. The kids in mixed status and undocumented immigrant families, their parents reported lower rates of the doctor-diagnosed health conditions, such as asthma, but I was having, again, a little bit of a hard time breaking out whether that means that the kids are healthier or whether they are less likely to see a doctor who provides that diagnosis, who, see a doctor regularly, a doctor who knows the child and who takes the time to make that diagnosis. So a little bit hard to say. And in terms of the global reports of children's health, the children of immigrants looked a little better, but again, these things are are a little bit squishy, and there's also some translation problems in that self-reported health measure. So it tends to be reported a little bit differently in Spanish than in English because of the connotations of the words. In general, research tends to show, an immigrant health advantage for adults, and that seems to hold for kids, although the findings are a little bit mixed. And then in terms of children of immigrants, you see that they have healthier birth weights than kids in Native families, but their health throughout childhood, again, the findings are a little bit mixed, is my understanding.
So a related question is, what is the role of language in getting health care and reporting health conditions?
Yeah, so I think that's a place where, things might be different in Los Angeles and in the rest of the country. I think that healthcare providers generally try to have some form of interpretation available, but how well that works, I think, varies place by place throughout the country. And sometimes, there is an interpreter available, but there might be somewhat of a delay, so that can create problems in emergency situations, or sometimes it's difficult to access when you show up to the doctor. Sometimes there may be a child with a parent, and the child is asked to interpret and translate, and that's not always the most appropriate. So definitely in some places there are language barriers. In other places like LA, there may be a lot of Spanish-speaking healthcare providers, and so that's less of an issue. So it really depends on the location and the resources available and the skills available in that area among healthcare professionals and other workers in this setting. In terms of reporting on health, yeah, as I mentioned, in terms of these global measures, if that's the question in terms of surveys, there's some issue about the translation, but otherwise, these surveys that I used were conducted in English and Spanish, so it's always good when people can speak in their native language in reporting things.
Thank you. There's time for maybe one or two more questions. I want to make sure Don has a chance to ask anything else he would like to, and I have another question here too.
Yeah, well, one thing on the behavioral health, just a question about age cohort, and were you able to control for age given that within sibling groups particularly there may be more likelihood that the younger children would be U.S. citizen children and older children may not be?
Yep, exactly. So in the NHS study, definitely the U.S. citizen kids are younger than the undocumented kids. I did control for age, and generally, if there are sibling differences, we think that parents invest more in the first child than in later children, so that might say they're investing more in the undocumented kids, and that would kind of weigh against bias in the fact that younger kids are more likely to go to the doctor. So there are sibling age differences. I don't think it affects my results too much in the NHIS and MEP study. In terms of the behavioral problems, I did try to break things out by age because definitely there are differences among kids in different ages. But the sample size got a little bit small, so I didn't have any conclusive findings that I feel comfortable reporting on in those age subset groups.
Great, thank you.
Mm-hmm.
A question, what is the evidence about the costs and benefits of providing health insurance coverage to mixed status and undocumented families? So, costs and benefits.
Yeah, that's a really good question. I think there are a few different considerations to think about. One is, as Don mentioned, there's kind of an understanding that undocumented immigrants who don't have health insurance are relying on, are waiting until health conditions get bad enough until they can go to the emergency room, and then emergency Medicaid will pick up the cost of stabilizing people from an emergency situation. So one thing is to think about is, as with health insurance for any other person in the U.S., is the cost of emergency versus preventive care. So, what are the costs of investing in that insurance that allows the preventive care versus the cost of the emergency care at the end. Another thing to think about is sort of the, Don had mentioned public health, so this is kind of an anecdotal thing, but there was the whooping cough epidemic that happened in California, and there have been other outbreaks of these types of things that are based on low vaccination rates. And part of the story we know is that U.S. parents aren't vaccinating their kids always, but the other part is that immigrant families who lack health insurance are sometimes having lower vaccination rates. And so if things are contagious, there's kind of public health consequences to having a certain portion of the population without health insurance coverage or access to health care. The majority of kids of undocumented immigrants, as I showed, are U.S. citizens themselves, and like other kids, they're part of the future of the country. So, there's costs and benefits to investing in children for their healthy growth and development, and childhood health definitely affects adult health and adult earnings and educational attainment and all of those things. And increasingly, it seems like the undocumented kids may be likely to stay in the United States for the long term too. The Obama's Deferred Action for Childhood Arrivals program was pretty popular. The DREAM Act, which would provide those same kids a green card, seems to be pretty popular too. So if you read the tea leaves of politics, it seems like at least undocumented kids are likely to stay in the country, and so treating them the same as other U.S. kids, might have some benefits as well.
Well, that would also have some implications for your, what you said earlier about the potential for the behavioral differences indicating differences in potential educational attainment.
Right, that's right. That the behavioral problems can also affect educational trajectories. Is that what you mean?
Yes.
Yeah.
Yep.
That's right.
So one last quick question. It could be a long question, but make it quick. How do you expect findings to be different in 2015 or 2016?
Well, you'd have to first predict what's going to happen with immigration reform, I think. Definitely, as Don mentioned, these are both really hot topics, both immigration policy and health insurance policies. So, I think the general trend seems to be in providing more rights to immigrants and expanding health insurance for everyone. So if I had to put my money down, I would put it on lower disparities in the future, but we'll definitely have to see about that.
Great. Well, thank you very much. Thank you for everyone who joined this conversation. Please do the exit survey as you leave, and we really appreciate the participation of Julia and Don and all of the audience. Thank you.
Once again, that does conclude today's call. We appreciate your participation.